Hello, everyone, and welcome to this episode. I'm Dr. Motahare, and today we're going to talk about benign prostatic hyperplasia or BPH based on the most recent American Urologic Association guidelines. In this session, I'll cover what actually BPH is, how common it is, what are the symptoms, and how doctors diagnose this problem. And finally, what treatment options are available now. Let's get started. Let's start with the definition. BPH stands for benign prostatic hyperplasia. It's a histologic diagnosis. It means that this name is based on what we see under the microscope. Prostatic smooth muscle proliferation, prostatic gland proliferation, and also connective tissue proliferation. But we should consider that the prostatic tissue can be so enlarged because of BPH, but patient just experiences a little symptoms, or it will be just a little enlarged, but patients experience lots of symptoms. So the size of the prostate not always correlate with the symptoms. Sometimes a small enlargement leads to very severe symptoms, and sometimes very big prostate tissue do not produce any bothering symptoms. BPH becomes more common as men get older. About 50 to 60% of men in their 60s have histological features of BPH. And that number rises to nearly 80% by the age 80. However, not everyone with BPH tissue changes developed symptoms, as I mentioned before. Lower urinary tract symptoms, which means, for example, frequency, urgency, dribbling, and things that I will explain later, also become more prevalent by age. By the age of 18, nearly half of the men report moderate to severe lower urinary tract symptoms. This makes BPH one of the most common conditions seen in urology. Symptoms of BPH include frequent or urgent need to urinate, wake up often at night to urinate, which is called nocturia, a weak or slow urine stream, difficulty starting to urinate, the sensation of incomplete bladder emptying, dribbling after urination. These symptoms are more common. There are other symptoms too, like pain during urination or after ejaculation, urinary incontinence, and changes in the urine color and smell. Diagnosis starts with a history. We'll ask about all symptoms. Then maybe we think about, oh, maybe it's BPH. So we'll do the next step first. The first one is a complete physical exam that includes a digital rectal exam. In this exam, we will understand the texture of prostate. Is it soft or it's nodular and firm? Differential diagnosis is completely different. If we feel any nodularity, we will ask for other tests like prostatic biopsy in order to rule out malignancies. We also will ask for a prostatic sonography imaging to understand the size, shape, and texture. Sometimes we need a post-voided sonography in order to understand how much urine retains in the bladder after urination. Sometimes we need to do a cystoscopy to rule out the bladder-related problems. PSA test is also very important to differentiate between benign and malignant causes. It's not 100%, but when there is some situation for both PSA and pre-PSA, we will suspect to, for example, malignancy and ask for biopsy, prostatic biopsy. All depends to what we think uh, about these patients. We should rule out all other possibilities in order to address BPH correctly and also assess the severity of problem. Treatment decisions are guided by the severity of symptoms. For men with mild, not too much bothering symptoms, watchful waiting and some lifestyle modification like reducing the amount of water before going to bed and also reducing the amount of caffeine and alcohol is recommended. For more symptoms, medication are often the first line and also are effective. When medication are not effective, we are going to next step that are minimally invasive therapies like urolift or the gold standard TURP. And if the prostate is too much big, we can use simple open prostatectomy. The choices depend on the patient's preference, prostate size, and also available expertise. That brings us to the end of this presentation about BPH. To summarize, BPH is very common, especially as men age, but not all of them require treatment. Evaluation focuses on symptoms, quality of life, and risk of progression. Treatment ranges from lifestyle advice to medication and surgery, depending on the patient's need. Thank you for watching. If you find this video helpful, please like, share, and subscribe to my channel. And don't forget to leave your question or comments below. I'll be happy to address them in the future videos. Thank you.